Methamphetamine use, especially when used often or for a long time, is associated with a higher risk of physical, mental, and social harms. So, the earlier people seek help, the better. Some studies have found a gap of up to 10 years from the first time someone experiences problems related to methamphetamine use to when they first seek help from health services. In Australia, women have been shown to be as likely as men to use methamphetamine weekly, but make up less than a third of people who access treatment for methamphetamine use disorder. We wanted to understand what the reason for this might be, and so set out to speak with women in Sydney who used methamphetamine regularly but had not accessed treatment for their use. We put up adverts in some of the public services around inner city Sydney, such as free clinics and women's refuges, and 11 women from diverse backgrounds contacted us to participate in this study and tell their story. They told us about their experiences with methamphetamine and health and their preferences for healthcare services so that we could understand what barriers women faced to accessing treatment and start to think on how best to overcome them. This is what they said. Many of the women noted the positive aspects of their use, such as for recreation, socialising, or to be more productive. But they felt stigmatised in institutions such as the criminal justice system and the healthcare system. For instance, some women said that they felt shame when disclosing their methamphetamine use status to healthcare professionals and said that they didn't feel understood. The women also described how their methamphetamine use affected their intimate relationship and how it could be associated with violence or coercive control. Other family relationships were also complicated. Some of the women reported judgment from their families because of their drug use and talked of sorrow around having their children removed. Despite this, family were also spoken of as a source of hope to change their methamphetamine use. What might this mean for healthcare services? What these women wanted was to have a trusted, consistent healthcare provider to avoid stigmatising attitudes or discriminatory behaviours. They also did not want to have to tell their story again and again and again. The women we spoke to had needs across multiple domains, including their physical and mental health, income precarity and social support, and involvement in the criminal justice system. As such, they preferred a single entry point and services provided by an integrated and coordinated care team that can address these interrelated needs. The women had all experienced judgment and stigma, therefore noting the need for healthcare to be provided without judgment and with understanding and empathy. We need to address stigma, and so we need to upskill the health workforce to understand the way that the stigma of methamphetamine and drug use works. This could empower workers to actively manage the stigma of methamphetamine consumption and have health-promoting conversations that are relevant to a person's substance use goals and beliefs. We need to work with the person and their relationships. Other research has shown the importance of actively involving families and social networks to support people going through treatment and recovery. The women told us about feeling powerless within institutions. Some strategies that might help address this imbalance include employing workers with lived experience of substance use and offering assessment and treatment outside of the institutional setting, such as within community-based, outreach or digital health modalities. The women we spoke to showed resilience in the face of multiple social challenges. This requires not just integrated care across services, but also structurally competent healthcare, where health is understood as a product of social structures such as race, poverty and class, not just in terms of individual risk behaviour. It's likely that these findings would not apply to all women who use methamphetamine, especially in areas outside of Sydney or for people who might not regularly use the services where we advertised. Nonetheless, the rich stories provided by these women give us a good idea on where we might start to improve access to healthcare for women who use methamphetamine. You can read more about this study in the journal BMC Health Services Research.